May dagdag na paraan laban sa COVID-19. Together, we can be the Solusyon Plus. Bida Plus sa maayos na daloy ng hangin. Bida Plus sa maikling pisikal na interaksyon. Bida Plus sa pagsuporta sa bakuna. Bida Plus sa mga kwento ng kaligtasan sa Bida Barangay. Sa dagdag na pag-iingat, maraming buhay ang maliligtas. Bida Solusyon Plus laban sa COVID-19.
The views and opinions expressed by the host do not necessarily state or reflect those of the hospital and its management. Furthermore, the views and opinions of the guests do not reflect those of the host, the show, the management, and the hospital. Lastly, no copyright infringement intended. All materials used and music background credit to the owner for public service purposes only.
Alright, good afternoon mga ka-quarantine. Welcome to Tatak Sotto.
Oh, yes.
Alright, mayang gabi, Bernes na pod, Senyor Paul, no?
Usa ka mabugnaw nga kahaponon alang sa atong mga quarantine
Ka-quarantine. Alright, so hello Attorney Paul and Honey, kumusta?
Maayong hapon, attorney, o na-vaccinate na yun, no?
Wow.
Nakapasok ko sa inyo ha last week. Nasuya ako last week, wala ko ma-appeal. But this week, ano na yun ko, bakunado.
Bakunado na. So, bakunado na tantulo.
Oh, yeah.
Okay na. First level. Okay.
Okay na,
Honey,
okay na.
tell us about your experience.
Ano, attorney, actually, kanang smooth. So, kaya akong experience, no? Na-amaze din po. Katong gisura ninyo last week, bitaw, nga kanang maayo kayo nga atong mga vaccinator and I have really experienced it myself. Kaya, pagbakuna, sa ako ang vaccinator, si Miss Ana ni Menzo. Hi, ma'am.
Hi.
Kanang, murag yun, wala ra gyud toy na feel.
Si Miss Ana.
Oh, Miss Ana.
Wala man ka nag-advise. Ako to'y mo volunteer para nimo.
Okay, baka mo injection yun?
Itupok mo na
Huwag mo na, perpendicular man siguro na. Dapat 90 degrees.
Manupukay beta. Manupukay.
Alright, no, mga ka-quarantine, kumusta ka mo diha? Bisag asa mo dapita karon sa Panimalay, sa Sakyanan.
Wherever you are.
Wherever you are, welcome to Tatak Sotto. Og naagitay grabe kayo ron nga pagahisgutan, di ba? Kay gitawag ni siya unsa ni Batang Sotto.
Batang Sotto.
Unsa imuhang opinion ng Batang Sotto nyor?
Kauban na siya nyor sa Batang Tundo.
Oh, meaning
Meaning,
Nagtako.
diha jud ka na affiliate, diha jud ka na himugso, diha jud ka identify jud ka. Identify jud ka.
Wow.
Right, anak.
Yeah, and we would like to acknowledge our live viewers, no, from Lolita David, Wilma Estender, Lourdes Gallego, kinsa pa na diha ni Rodi, Dr. Rodi Amatong, then we have Alpas,
Doc Amatong, hi.
Hello.
Si Ma'am
Then naka-cross post po taron yor. Ani, so asa ta naka-cross post? Inyo sa ming makita sa
Nata sa OPA, napunta sa Cebu City PIO, Junar Chang, Fox, NDOH.
So mao kini
That's
ang mga
correct.
different social media sites nga nag cross post sa ato ang Tatak Sotto kay for the 5 days sa usa ka semana lain-lain natong programa kada hapon para
Yes,
sa
that's
public
correct.
health promotion.
And rightly so, dapat yun ta maka-hook in your because our discussion or issues has something to do with public interest.
Yes, public
So,
interest.
mura ra siya og pamilok niyor kung atong ikumparar ang laktaw gikan sa atong previous nga programming, no?
Yes.
Di pa to dugay nga nagkahimamatay ta.
Ay, di pa to.
Malipayon ko na-appeal ko bagay makita gyud ta. Kada usa ka minuto kay murag usa ra ka minuto, murag usa ra ka pamilok.
Usara ka mamilok nga diretso na dayon Bernes na.
Onya, if you can recall, last na to nga program, nagisgutan, nag-hype tanyor about vaccination and
Yes.
indeed it was effective.
Effective.
Because
Kay ngano?
from there on, Saturday, Sunday, Lunes, Martes, Miyerkules, hangtod karon ang
Hangtod
katapusan.
karong adlaw ha.
Nunot kayo ang atong mga kaigsuunan, mga ka-quarantine, nganing avail sa vaccination.
Yes.
Oh,
Og
yeah.
Zero. Hurot ang ato ang allocation. Og sakto ra gyud kay 3,600 yun, no? Daghan kayong salamat.
That's correct.
Yeah, to our
Daghang
vaccination
salamat.
team.
Yes, and tinuod no, supposedly gani na human ang atong 7-day vaccination kagahapon, but we made an extension until today kay nakita ginamo nga daghan ang gusto gid gihapon magpag-vaccinate. So, and ang ato ang mga kauban gihapon sa mga naganalain-lain ospital, naka-avail man gihapon sila sa ato ang vaccine sama sa St. Anthony Mother and Child Hospital. We also have Eversley Child Sanitarium na apod ang sa ato Cebu South Medical Center. All
Yes.
from Eros and EOC of Cebu City na kauban gapon sila sa ato ang mga
These are our frontline healthcare
Yeah,
workers.
That's correct. So,
Daghang
sakto yun,
salamat.
Mayor. Sakto yun ang atong estratehiya that we always walk the talk. Ang ato yun mismo nga medical center chief, may una yun nga nagpahigayon.
Yes.
Ning submit sa vaccination. Aron nga, laras yun yun. Ako
Hurot.
mismo. Hurot
Hurot,
yun.
good,
Oh.
hurot. Mao na sakto.
Mao na sakto.
Okay. Lahi na gyud kung ang imo ng top leader mo nagpakita sa pagsugod nyor. Hurot gyud.
That's leadership by example.
Yeah. Og nasundan pa gyud sa atong mga komunidad sa katong gi-mention ni Hani nga mga different public hospitals nga ni join po sa Sotto vaccination.
That's correct.
Inyong tanan, daghang salamat. Purely Tatak Sotto yun kayo ni ato ang mga
Tatak
vaccination
Sotto.
team. Og inyo sad kami, you can always have our social media accounts, okay? I'll start with Facebook. Our official Facebook handle is @officialBSMMC.
And we also have our Twitter. Pwede niyo na siya makita sa @officialBSMMC.
And naturally, you can also view us sa atong YouTube, Vicente Sotto Memorial Medical Center.
Subscribe and follow us in all of these social media platforms.
That's
Or
correct.
you can also email us at osm@bsmmc.doh.gov.ph.
Oh, yeah.
Bisan kalos available ang ato mga programa para sa inyo.
Correct, no? Og naay nag-chat, anagi nag-comment diri live, no? Si Dr. Celia. Gwapa ninyo?
Ay,
Dr.
kana.
Celia Mabalatan.
Queen of
Wow!
Sotto na.
Hello mga attorneys, RC and Paul, Honey. So, hello, Dr. Mabalatan, Tatak
Ay.
Sotto kay ni.
Tatak Sotto na. Tatak Sotto na.
Kinsa pa diha?
Tapos, dili si Ma'am Joppy Girl Andaya. Iko siya shout out sa mga kinahusgang batang Sotto, Dr. Rudy Amatong and Dr. Ramon Nahara.
Shout
Wow!
out! Oh, yeah.
Dili ra day usa ang Batang Soto. Napo rin si Dr. Rudy Amatong Batang Soto po din ni. Oh, og kini, speaking about Batang Soto, #greatness, I think nyor atog yung ipaila ni ang atong Tatak Batang Soto karong hapuna.
Batang Sotto na nyo, ha? Di na tiguang Sotto nyo.
Oh, Batang Soto. Okay, senyor, unsa man nimo na dili sana to i-reveal
Kana. Oh.
Unsa man nimong kina pareha ba kita no bag-o
Kana.
na ni nga institusyon.
Bago ta.
Yeah,
Batang
pero-
Sotto.
Batang Soto.
Bata pa sa Sotto.
Bata pa sa Sotto. Okay. Pero
Oh.
di ba we work with this our feature karong hapuna no sa Execom no. So
Yes.
ikay una nyor unsa man nimo kasulti ani ato ang Batang Soto
Kini
karon.
atong Batang Sotto karon, cool gini siya, nagpabili ni siya nga bata. O niya very professional. Ilok yan sa ding ato ang Batang Sotto karon nga atong i-feature. Nya I believe nga daghan tang makatuna na ini. Galing lang usa sa iyang regret sa iyang kinabuhi. Na siya regret nyor.
Unsa yung regret?
Ingon siya nganong sayo kay ko gipanganak. Nasuya siya dato nyor.
Suya sa kay kita
Kaya
Batang
unahuna
Soto.
niya, kung later pa siya gipanganak, basin og ikaparang nato siya sa kagwapo karon.
Mo na naka-diferensya diha. Okay, Doc, thank you for your Doc. I'm sure kamo mga ka-quarantine o mga taga-Sotonians, gusto kay mo makahibaw unsa nimong gisgutan karon nga Batang Soto, Tatak Batang Soto. Before that, amo pag yung patilawon og lain pag yun nga experience, Honey. Kumusta man imo ang experience ani atong ito og Batang Soto?
Ako experience no ani niya kay first of all gwapo gid siya no.
Oh, good, no?
Gwapo gid.
Sorry.
Na-experience yun nimo yang kagwapo.
Pag
Ayan.
makita mo siya makita siya gwapo gid si Doc.
Oh,
and
And
then?
not just inana but very cool. Sakto tayo mong giingon.
Cool, no?
Nabi
Cool.
time nga ano siya, nag-gitara siya.
Oh, rocker ni, rocker.
Rocker.
Hey, Jude.
And ano po siya ka
Mm.
kung mag-meet ni sa PSG before, gibutan siya.
Yes.
Buutan siya. Buutan.
Sa mo na balan is dugay nagit sa din ba ang iyahang commitment and love for Sotto kay nagpadayon gyud.
Yes.
Ako nyo, personally, pasalamat ko ning atong Batang Sotto karon kay to the last hour, to the last day of his official day diri service diri sa ato ang tambalanan, no? Iya yung gi-perform ang iyang trabaho. And in fact, he even accepted other responsibilities nga biyan na sa iyang
Bitaw.
supposedly, no?
Believe
Nga
ko
function.
niya.
Okay kayo.
Ako experience ni niya good kay my first travel nga nana ko diri sa Sotto is with him. We were in Philippine Heart Center.
Kana.
Di pa mi kaila to, but grabe na ang dynamics nga we have to present something for the institution niya. I found that he's really a good mentor. In fact, sa OSM no, si kini atong batang Sotto is mura ni na magamahan. We always go to him and then refer to him for some inputs kay quality person po gani. Tiko-tiko og detalye nyor.
Indeed.
Bright. Grabe ka talented. Papa ni siya ni Ann, adopted father ni Ann Comendador. So kamo mga ka-quarantine team, like pareha na mo diri karon excited no ang
Very
department
much excited.
of pediatrics excited pod kayo kay wala tay lain no atong chairman
Oh yeah.
of the Department of Pediatrics.
Why lain?
Pinalangga kinsa Dr.
Ramon Naharo. Oh
Please
yeah.
watch this.
Natungog ka ba sa kapalaran? Ang atong istorya karon kabahin sa kinabuhi ni Dr. Ramon V. Naharo. Nang bisan pa sa wala pa siya mahimugso, daw kiplano na sa universo nga siya mamahimo nga isa ka dakong haligi diri sa Sotto.
I believe that there are some things nga wa ni mo giplan pero may mahitabo. For example, my stay in Sotto was really unplanned, no? Og si John Lennon pa yung pasultiyon siya, life is what happens when you're busy making plans. So ang wa ni mo giplano mo nahitabo. I think my mom was destined to stay here. Kay in the first place, pharmacist to siya. Yeah, probably you would say nga ambot nerd mo term ti anak karon no? But she was very studious. She actually was the first summa cum laude nga female sa San Carlos and the first female nga board of nurture in pharmacy. Despite all of this, she decided to work here in Sotto. And in fact, during their later years when I already became a doctor, she really wanted me to work here in Sotto. Di ko kasabot at that point unsay wisdom anak niya nga butanga ba.
Tungod sa pagpanarbaho sa iyang inahan diri, nagdako si Dr. Naharo sa palibot sa Sotto. Ang pasikaran sa institusyon, mao ang iyang dulaanan ug ang mga trabahante diri na mahimo na niya nga ikaduha ka pamilya.
Dr. Naharo was growing up, wala pa to siya ma-doctor at that time. I often see him in the office of his mom. Kay then his mom was a property section head. Then he comes to the office after school. So I see him running around and a very playful Dr. Naharo.
I grew up, mo nagtawag niya Tatak, batang Sotto gito niya ko, no? People are sometimes surprised, no? Ngano na ako nganhi, but I tell them, you know what, I grew up here. Akong immunizations were done here, so na ako yung mga painful memories ang ito sukon ko. Pero anyway, ikaw man pakanoon mamaya to. Okay.
Sa panahon, wala gayud gihandom ni Dr. Naharo nga siya mamahimong usa ka doktor. Apan, daw gigayahan siya sa kapalaran nga moulagad sa katawhan, hilabi na sa mga kabataan.
I chose to be a doctor again, not out of any kanang plan, no? But kinibatan-on pata na atay mga friends, mga barkada, we decided to go to this school, and then we ended up being doctors, no? So we went through pre-med and then we went to medical school. Murag, in fact, ang ilang tawag-tawag na, murag ligoy-ligoy lang ko, no? Pero we still ended up being doctors. So, destiny. If you look at our yearbook sa Sotto, ang gibutangad to, specialty, akong gibutangad to, I wanted to be in surgery. Because everybody wants to be a surgeon when you're that young, no? But again, somehow, circumstances arose nga when I came back here, because I went to some other place initially. When I came back here, the mga programs were all closed. And anyway, I ended up initially in radiology. But when I was in radiology, I felt I was not cut out for radiology. At that time, good, no? Maybe not anymore now. Kaya naman tayo itawag na itong interventional. But at that time, radiology was just x-rays and there was no patient contact. And I felt nga, dili man imong essence nako sa pagka-doktor nako. Wala na ko contact with my patients. So that's why I shifted to a clinical nga department. So that would have been either medicine or pediatrics. Again, at that time, pediatrics was open. So, mo na nga ngadto ko sa pediatrics.
Sulod sa 36 ka tuig, sukad sa iyang pagka-PGI o pagka-residente, hangtod karon nga nahimo na siya nga medical specialist 4, si Dr. Naharro nagpabilin sa pag-alagad sa Sotto.
Sa tanan nga kanang mga kalisod-lisod, sometimes nam get points nga lisod mo kay ni siya bro. At no point gid ko in my career nga naghuna-huna nga I would be leaving Sotto. Murag wa gina siya mususo kung nauna.
I believe nga he is destined to be here in Sotto because sa iya lang mga pag-serve sa patients, pag-work diri sa Sotto, makita man nimo ang iya yung compassion to serve the Senti Sotto.
I'm Dr. Elmer Kent Lopez, so I'm one of the medical specialists sa atong Department of Pediatrics. Nagstorya one time na ko si Dr. Naharro, di ba? He was a graduate here sa ato ang pedia. And then later on, nag-specialista, nag-training. So, murag ni, kuan na po siya, murag one of the known pediatrician in Cebu na po siya. One time, murag nakashare niya sa ako nga naay consultants from other private hospitals dito sa Cebu. Kay nibalik man si Dr. Naharro dere. So, giinan daw siya nga, umon, nganong magsoto man ka. Kay sabot ato niya, nganong di daw mag more on private practice. Kay, di ba, ato ka sa private practice, you can earn more than what we can earn from a public institution kintahay. So, mo to, niingon siya nga, mura gi-convince siya nga more on private practice than Vicente Sotto, but despite ana nga kuan, Dr. Naharro stayed with us and up to now nga padong na siya mo retire. So kana palandaan, it showed nga sa iyang commitment no to start and end his career here sa Sotto.
Inubanan sa iyang kakugi ug paningkamot, nakigbisog siya alang sa pagpalambo sa Sotto. Hilabi na sa departamento kung asa siya nahimutang, ang Department of Pediatrics.
I find Sotto to be a good quote-unquote place. Murag dili bitaw nindot, dili murag subpar ang the way it was performing. And the reputation was not very good. And I had this resolve na ug ari ko nga rin, there must be some change. No, nga kanang if I can create whatever I can create, or ang ako lang point is when I leave Sotto, it will be a better place than when I came in. Inana ba?
Improvements good with his leadership. Okay, so 10 years ago, og imo compare karon lahi na gid kaayo. So not only in pediatrics ha, Vicente Sotto in general.
Gawas ni ini, si Dr. Naharro usa-usab kada kung parte nga nahimong posible ang paghatag sa Sotto sa serbisyo nga open heart surgery.
Okay, so I'm Dana Janiza B. Turqueza Mala. During our cardiac mission, I'm part of the cardiac mission man din. And then, I'm part of the team. He's also part of the team. Usa siya sa mga tao nga nganong nadayon ang cardiac mission ba, which also help a lot of people, especially those kanang wa gyud kwarta na magpa-opera. Dagan-dagan sa betog na operahan.
Ang kanang open heart surgery and beyond open heart surgery, kanang surgery for our kids, no? Came about because initially natay kanang gitawag og package gikan sa PhilHealth. So actually this open heart surgery was already being done in some other hospitals, no? Although far and in between, dili ingon daghan, jutere mo operahan. Again, if you notice, a lot of our patients cannot afford, even the middle class, no? Lisod kayong mo gasto kag open heart surgery. So before, we had to send them to heart center. Unya, imagine na ang gasto nila besides the expenses there, ang travel nila, ang lodging, and all those things. So anyway, when this came about, we had our open heart surgery. It was successful. Then again, some other groups, including a group from abroad, no, came in and helped us out. Gitawag itong International Children's Heart Foundation. And with the help again of Philippine Heart Center, because we are now considered an affiliate of the Heart Center gihapon, no? We were able to establish kanang atong gitawag og pediatric cardiac na open heart na surgery na program. And we've been doing this regularly. Unfortunately, again, because of the COVID, na stop na siya for the pila ka months karon, no? But when you come to think of it, it has already at least, during the first 1 to 2 years, served so many patients na operahan. I mean, open heart is not, di ba siya, is sayon lang nga kuan ba? Imagine na pila ka buok, 20 patients in one setting, operahan, no? That is for 2 weeks. Yeah, they come back again, do this again. So, we do have our own surgeons, and now, so cooperation na siya. So, it's give and take, no? So, ang atong surgeons are also part of the free services, including our surgeons from the private hospitals, no? Some of whom are also part of our staff here. So it's really a very nice thing, literally heartwarming. Makakita ka nga ang mga pasyente, makakita ka nga who used to atong una nga panahon. Kaya ba ka mamatay lang ni sila kaya di mo operahan. Now you're seeing them alive. 1 year after you see them, idako na, no? So nice kayo.
Ang dedikasyon ni Dr. Naharo sa pagtabang sa iyang mga pasyente dili gayud hikatunan. Walay pagpihig ang iyang pag-atiman kanina.
One is, regardless of whether you're a service patient or a private patient, you're still a patient. So you deserve the best from your doctor. Now, since we're talking about compassion, no, and so that's one of the things I always tell my residents. What's the difference between pity and compassion? Pity is when you look at them from your point of view, or sympathy. No, it's more of unsay mo nakita, unsay na mental na siya. Compassion really is you feel for the patient. So it's basically like empathy na siya, empathy na. That actually galvanizes you into action. Kaya pity good, maluoy ramon ka. But when you have the compassion, you see your patient, you fit into the patient's shoes, no? Musulgi ka sa pasyente. I mean, kana mo lang yung putting myself in the other shoe ba, in some other person's shoe. Makakita ka sa problema sa pamilya and all these things. Then you become more responsive to their needs. You become more sensitive to their needs. So, dili ka ingon nga mga saba kaayo. You really end up with more of advising them, counseling them, and understanding them really. O si St. Ignatius Mantingali to, hindi na ko pinunod. He said nga, you enter into the chaos of your fellow man.
A charity patient, and then really need that examination, that medication. So, kuhaan yun ng resources to help that patient. Not just kung saan na i-exhaust yun na ng resources na pwede makatagaan ang patient. Ang iyang drive to serve the dili kayo privilege na to ng mga igsuon na
Dr. Naharo is a pediatric intensive care specialist siya. So, specialista sa ICU sa mga bata. So, with that alone, so mga critical patients ginayang i-handle. So, the more hands-on si Dr. Naharo sa iyang mga pasyente. So, sa department, sa PICO, so siya may first na itong section head sa PICO na to, section sa Pediatric Intensive Care Unit. So, with that alone, so kuan gina siya very hands-on.
Dili na maihap ang iyang mga natabangan. Ang pipila gani kanila, dili na gayon siya makalimtan. Kay siya na mahimo na nga dakong parte sa ilang kinabuhi.
Well, I have a lot of unforgettable patients. But I think ang pinaka-gratifying is knowing na some of your patients eventually end up as your co-workers. Well, one of my patients then, bata, na-admit in another hospital, critical, was operated on all these things. Niya, survived, no? And then, when time came for residency na, yung mga doctors mo apply, I asked this applicant, why did you apply for residency here? He said, Doc, you do not remember. You treated my child. So, and the other one was, I had 2 patients, igsuon sila nga, meningococcemia. If you know what meningococcemia is, it's a severe disease. Again, in another hospital. But both of them survived. And then, the next thing I knew, after several years, nakita na ako siya. In fact, I did not recognize her at first. She approached me. Niya, Dok, si Ranat bitaw ko, Dok, imo kong pasyente atong una, Dok, ng meningococcemia. So, these are very gratifying lang mga experience.
Bisan sa kadaghan na sa iyang nakabot, giila gihapon ni Dr. Naharo na dili kini niya mahimo kung wala ang suporta sa uban. Ug ang kini nga pagtulunan gipadayag usab niya sa ilang departamento.
Because unsa na to ka-dedicated, unsaon na to ka-committed. If you don't have a team, a proper team, you're still not effective. Especially among the doctors and the health workers. When we talk about teamwork, kami sa doctors, we have our own teams. But that's what we call a multidisciplinary team, meaning rather an interdisciplinary thing where we have our own team and then other specialties, surgery, OB have their own teams, but we come together gihapon. But we also have the multidisciplinary team where we have the nurses. We cannot live without the nurses. Para nako, importante kaya sila. We cannot live without the support staff, no? Unsa ang pag-function sa hospital kung walay nag-follow up sa budget, walay nag-follow up sa supplies and materials. So everyone is an important part in the cog, no? In the wheel.
So doon na gear teamwork. So kana one of the working atmosphere nga develop pod ni Dr. Naharo as our leader, kana teamwork helps a lot, you know, kay walay iza-iza, walay aho. So if we will work together, times 2, times 3 ang atong output.
Ang kinabuhi ni Dr. Naharo suod nga nalambigit sa Sotto. Wala kini niya giplano apan gitagana gayud siya alang sa pagserbisyo sa institusyon. Karon nga nahuduol na ang iyang pagretiro, mao kini ang mga pagtulunan nga iyang ikabilin.
The salt of the earth. You are the salt of the earth. So as a person, no, nakadiha to help others. Kung matanon ta mo, umukaon ka og asin pamahaw paniadto panihapon, malipay ka, dili. Sa gulo natong pepper, so your salt and pepper of the earth. Di gyapon, no. But ang pagkaon nga walay asin, walay lamisan, no. So you are there, maybe in the background lang ka, no. But you actually enable others. What you do is you let others flourish. To all our viewers, friends, fellow ka-quarantine, good afternoon, good evening. Thank you for watching Tatak Sotto. I hope you enjoy this episode.
Dr. Naharo is very hardworking and very straightforward in giving his thoughts and decisions.
Two adjectives comes into my mind when I think of Dr. Ramon Naharo. First is, he is very diplomatic. Several times I have observed Dr. Naharo. He has a way of expressing his opinion or ideas in a well-mannered way without being aggressive or offending someone. He has a way of telling you or pointing your mistakes without offending. Secondly, he is very articulate. He knows how to express himself without being tactless. Thank you.
Dr. Naharo, they are asking me to describe you in 5 words or adjectives, and I would like to explain it why. Okay? Dr. Naharo is a multi-talented individual. He's a father, a husband, not just a pediatric intensivist, chief of clinics, but also a very good guitar player and good singer. Pero dili siya makalupig nako sa dancing. I also look to him as a big brother figure, always willing to give advices and assistance to those who need one. Okay? He's also third is he's versatile. He's able to adapt to different situations and ready to make compromises when confronted with conflicts. Fourth, he's a good leader. Motivates and leads by example. and pushes his subordinates to always aim for excellence and not just be contented with mediocrity. And lastly, which is self-explanatory, he is handsome. Di ko kalupig, anak. Kras ng bayan. So that is Dr. Ramon Naharro. Thank you.
So, Mons, I've known Moncho for several years, way back in college. And he's a cool guy. Every time I see him, he has two friends. Almost 4 years, 5 years, magkita me. They always walk together, and then I think he's very fun with those two guys, classmate na niya, even in college. As a professional, he's very professional, and he's a good leader, especially sa pedia. In fact, I think he was also a president in pediatrics, and he goes to Manila so often. So, dagan kasi mga kaila, no? Especially even in private hospitals, and he's a friendly guy, and in fact, he pleases people. And opposite niya kay I'm also the very aggressive type, and I always voice out what I think. Si Mons, siya ay last na masulti, especially in Exicom. He doesn't like to offend people, but I always voice out things what is in my mind. And opposite niya ng napita niya. Well, he is also a mestizo, daghan naibog na niya sa mga chicks diri, mga younger generation. So Mons, even at your age, I still see that you still look young. So being young, and then being a retiree, don't forget nga I suggested to you regarding the retirees organization, may magkana mo organize. So I hope na your memory will still be there in the not only in pedia but in the whole hospital. Thank you.
I have been very fortunate to have been able to work with a person like Dr. Ramon Naharro. No? So we have worked so closely together in the Exicom, and he has been a very inspiring person to everyone. So Dr. Naharro, I know we will be seeing more of you, because not only will we miss you so much, but you will also be missing us, I'm sure. So Dr. Naharro has been really a very, one of the most level-headed person I've worked with, and a very compassionate one who's so hardworking and dedicated to the service of Vicente Sotto, as well as in general, for all patients that he meets. And he's very considerate to his subordinates, and has been a very good mentor for everybody, not only within the Department of Pediatrics, but also to everyone else, even in the Exicom. So I'm very thankful to have having been with him in this last number of years that he has worked with DSMC.
Dr. Ramon Naharro is one of the doctor that manifests an aura of one of the elite doctors here in Cebu, or even in the Philippines. So I really admired him because he is able to manage his time, attend all meetings. Another thing is I really admired him because he shows interest to learn new things even outside of his specialty. And lastly is, I really admired you because on your last day of service, you are still willing and offered your service to us. And thank you so much, Doc.
Dr. Naharro is a father figure, is a mentor, a leader, and a teacher. Dr. Naharro encourages me to push forward for the improvement of our services. And when other people want to take pictures with celebrities, I want to take pictures with Dr. Naharro. Kasi parang fangirling moment. So, yan, siya yung idol ko. And there was no voice in the Exicom for obstetrics and gynecology who's Dr. Naharro that we could really run to solve our problems.
No, deserve you kayong round of applause for Dr. Naharo. Atong papakan si Dr.
Oh, yeah.
Moncho Ramon Naharo. Hey, Dr. Naharo. Yes, yes.
Ako day, Han.
Nahilak naman na sa
Nahilak
people.
ako.
Bago pa
Kagwantag yun.
Wala
So, nakatuntaan ninyo, kining compassion di ay,
Yes.
sympathy, lahi na siya.
Lahi,
When
good.
you sympathize versus you empathize, kaya imo yung ibutang, imong kagalingon sa nahimutangan sa tabangonon.
Yes.
Grabe ning
Oh,
tawhana.
dili lang gyud ay no sympathy or pity, but for Dr. Naharo, ang dapat good for healthcare workers is always compassion or empathy. Sakto yung
Empathy,
Igo, good
nindot
kayo, no?
kaayo.
And we are also happy ba nga katong iyang kinigid yung story of the salt. The salt of the earth.
The salt of the earth.
Kita mga salt sa earth nga bisag asa tay butang, you know, we always have our purpose and we can always make a change.
Naagyoy maayo nga flavor nga imuhang i-bring out being a salt.
Yes.
So, usa sa maing butang aning tawhana because he really engages himself. Ihag yung gi-make himself, ihag yung gi-offer ang iyang services din sa Sotto kay kung asin manggug ka dapat musagol juga sa putahin no.
Yes, yes. Para mo lami.
Para mo lami.
Yes.
So,
Ang katong
nindot
story
kayo.
yung ganina attorney ba katong when you treat others with compassion,
Mhm.
you would really take an effort yun to touch their life in a way nga mula yun ang iyang impact. And katong kita, I really believe no nga for those persons nga masakit ilang anak or for the children na masakit, but if they are touched by a really good and compassionate doctor, makadugdong din sila. And that is
Yes.
a perfect example of Dr.
Yes, no? Very
And
good,
I
honey.
value.
Iya ka nang mubalik na nimo ba nga?
Mubalik na nimo.
Tambalan sa una, makahilag ka na.
Mag-resident
yun.
na.
Mag-resident na niya.
Na-touch siya.
Maduna
Duha to touch ato nyor. Na-touch siya kay grabe dahil ang akong service ning abot. Makaserbisyo pa ning bataa nga akong gitabangan.
Yes.
Ikaduha niya makaingon siya nga, tiguang na gyud ko. Dok Naharo, may gabi
Please,
diha.
Dr. Naharo, may gabi
Oo.
diha. We also have your daughter, no, Dr. Audrey Naharo, and the rest of the Department of Pediatrics. Daghang kayong salamat, no? And
We
our
salute you,
comment-
we salute you.
Nasa tayo mga comments no gikan sa tong comment box. O busy jud ka tong comment box karon, no? Like kini our Miss Darlene Page, no, watching from San Juan City.
Yes.
Tuning in for Dr. Maharo, ang heartthrob na mga residents during this time. Wow. Hi, Ma'am Darlene.
During his time.
Yeah, during his time.
Napod from Marisol Capo, Doc Moncho, #1 fan here. Napay Batang Sotto gid siya. And hello mga idols. Pati idol yun.
Idol yun, no?
Doc Moncho and Doc Elmer. Napay si Doc Elmer. Salamat, Doc. Thank you po sa atong mga naghatag of side stories for Doc
Right.
Naharo, sila Ma'am Sara, si Doc Elmer, and si Doc Dana. Thank you for
Yeah.
sharing.
And to the members of the Exicom, no, thank you so much for your greetings for Dr. Naharo and good words for our Dr. Naharo. And
Yes.
we also have here from Rina Ruby Caminade Pinili, proud Sotto resident here. You are my idol and inspiration. Wow!
Daghan nag-idol ni Dr. Naharo.
Daghan.
Oh, idol ko yan, si Dr. Moncho Naharo. Matod pa ni Dr. Helen Madamba. Wow.
Si Dr. Montanzas, Dr. Naharo is generous with his charming smile and sincere hello to everyone in the
Res ipsa. Look ito.
Yes,
The
dili
thing
na.
speaks for itself.
Katagaingon ba, no?
Oh.
Katong naong ni Dr. Naharo, mao na. Dili na malabuan. Very talented Dr. Naharo from Alaysa Lim. Daghang kay mga comments here. Magliso na tawag basa kay nagpusot-pusot ang comment, no? Kay Joe Testabaring, hopefully manawat na mo or for elective. Yes, soon.
Grabe kayo, grabe.
Grabe kayo.
Iambus ti kanyor, be?
Napa yun eh? Moncho Naharo nyor.
Be.
Good evening. Thanks for the memories. Dr. Naharo, thank you for the memories. O kuyog pamana na siya.
Murag lain man paminaw ng thanks for the memories, Doc.
Yes.
Ambuso na ko si Attorney RC.
Yes.
If you can recall during your last Exicom, you were present. Nag-mention dito nga the OSM will look into possibility
Yes.
that you can still be part of the Exicom. No?
Yes.
Even if you are already retired. Kanya, I'd like to make this announcement. Si Dr. Aquino has already signed. This is the first announcement. Wa pa kay Boss Doc Aquino. Doc Aquino naman. Pirma wa kay Bao. Sorry, Doc. Si Doc Naharo mong musabot. Ako sa kay Bao, honey, that he is already appointed as 1 peso consultant.
Yay! Mona, Dr. Naharo, congratulations. We want to keep you here. Lisod buhian, sama sa gugma.
Wow.
Wow, alright. Gugma, no?
Dok, tala na rin na pa siya bahirit no sa intern pa mi bahalag way tulog basta siya mo pa duty.
Wow!
Ano siya nga source of encouragement.
Napay Ruvan Jao, kuyugan jud og grounds basta naa si Doc sa Pico, idol jud and down to earth. Wow. Very good, no? Very good. And Dr. Naharo, you will always be here and always be part of Sotto. You are our tatak batang Sotto. So those are our mga mga comments sa atong sections here. And again, thank you so much Dr. Ramon Naharo. Natin mga pasalamatan. Yes, Nyor? Startas atong Medical Center Chief.
Dr. Gerardo M. Aquino, Doc, salamat kayo. Speaking of teamwork, ingon si Dr. Naharo, the time that he enters, it's not the same ang Sotto, the time that he left Sotto. So, dako kayo part ang teamwork, and I believe that our Medical Center Chief has also a big role sa pagpalambo sa ato ang Medical Center. Daghang salamat, Dr. Aquino.
Yan, ay pahabol nga greetings diri, from Raquel Tadike. Dr. Naharo is the pedia of my son when I delivered my baby. Thank you, Doc, for being the best pedia for my son. That was more than 8 years ago. Wow! Nag-watch na Dr. Naharo ang imuhang mga clients, no? Mga mamas sa mga bata. Alright. Isa pa itong pasalamatan, Honey.
Also like to thank hapon ang ating hapon sa Department of Health, si Dr. Jaime Bernada. Thank you so much for all your support sa hapon sa tayo.
Right, for our sub-national laboratory team led by Dr. Renette Ligaray. Daghang kayong salamat, Doc, og sa tibuok SNL, og sa atong COVID health facility, atong healthcare workers. Daghan kaayong salamat kaninyong tanan.
Daghang salamat.
Ayaw mo kalimot sa pag-follow sa atong mga social media accounts. You have there, Facebook, at Official VSMMC.
Sa Twitter, at Official VSMMC, and
YouTube nato, Vicente Sotto Memorial Medical Center, of course.
Huwag din lang may magdugay kay tungod atong panahon limitado. Basta always remember, dinhi sa Sotto, kalidad nga serbisyo, among garbo. Kini si RC.
Kini si Honey.
Kini usab si Paul.
Daghang salamat, mao kini ang Sotto Live. Tatak Sotto. Daghang salamat.
Salamat.
Oh yeah.